What's going on, everyone? Dr. Tom Walters here, back from Rehab Science. Thanks for coming back to my channel. Today we are going to look at 3 hip exercises that have been shown in the research to help people with low back pain. Oftentimes people with back pain, their symptoms are really acute and irritable, and doing back exercises might be too aggravating, or you're doing back exercises and you want to know about maybe other strategies to help get better. If either of those cases describe your situation, stay tuned. We're going to look at 3 exercises for the hip that can help reduce back pain. As I mentioned, we've got some research where they basically looked at hip exercises and how they would influence back pain, and found in this particular study, which I'll cite down below, that there were 3 exercises for the hip, primarily targeting the gluteal muscles, that helped people who had active low back symptoms. And I've seen this a lot with different patients over the years. Sometimes people, like I mentioned before, have too much pain, and back exercises, low back exercises, cause more pain. So we'll start with hip exercises, especially those glute exercises, and people often notice a quick reduction in their symptoms. So we're going to look at 3 exercises. This first one is one where all of them will be down on the ground. One will involve a band, so I'll show that in a second. But this first one, what you're going to do is come down on your forearms, and you're going to do all of these exercises on both legs. We're going to work both hips to help your low back. So I'm just going to show one side, but again, do both legs. You're going to be down here on your forearms, almost like you're going to do a plank, and then your knees are both going to stay on the ground, and then we're going to lift one leg. So that leg is going to lift up to about where my thigh is level with my trunk. My knee will be right at about 90 degrees, and this is going to work my gluteus maximus primarily. And the nice thing about this is that my back stays in a relatively neutral position with the other knee being on the ground. So I'm just going to go up and down like that to work the glute of the leg that's moving. On all these exercises, I want you to go for 1 to 3 sets of around 10 repetitions. So you could do 10, and then what I would probably do is switch over to the other side, do 10 on that side down until your knee touches, and then back up. Go through 10 like that. What you might do is just do 10 on each leg, and then go to the next exercise. There will be 3 exercises in this video, so you'd end up doing, like I say, a set of 10 on each leg for the 3 exercises, and then just see how your back feels. If that seems to help, then that's great. You could add another set the next day, or a day, the 2 days out from that. Or if it seems like it's too much, just start with one exercise, wait till the next day, see how you feel, and then add the next one. So, all right, so let's jump into the next video. For the second exercise, we're going to use a loop resistance band. This band is from a kit I have of different products. I'll put the link down below. It basically just has all of the rehab products I use in my videos and posts, so you can get it all in one spot if that's something that's helpful to you. But these loop bands you can also just find on Amazon and things like that. So for this one, we're going to put it around our feet and up around our knees. This is a pretty standard exercise a lot of people are familiar with. Again, make sure you do it on both sides. I'm going to lay on my right side to start with, and I'm going to be working my top leg. My legs are going to be stacked, and this is called the clamshell. What's going to happen is my feet are going to stay together. I'm going to open that top knee as far as I can without rotating my back. Okay, so it's just a hip movement. This is going to work the external rotators of our hip, which are going to be gluteus maximus and some of our other deeper rotator muscles. So just up and down slowly as far as that hip can open. Again, go for 10 repetitions, and then either do another set on this leg or roll over and do the other leg. The last exercise is one I've covered in other videos. It's one of the best exercises, honestly, out there for the hip and low back. It's the single leg bridge. It has some of the highest EMG activity for gluteus medius and gluteus minimus. So this one you're going to lay back. If a single leg bridge, sometimes people with back pain have more back pain with single leg bridges, so if that's the case, just go to a double leg bridge, that's fine. You could even add the band from the last video to make it more challenging. But if you can do this one, it's an even more challenging option. So I'm going to have one leg on the ground, the other one I'm going to lift up, and then I'm just going to lift up into a bridge where there's a straight line from my thigh up to my shoulder, and then back down. Again, like the other exercises, shoot for 10 repetitions, and then perform the same exercise on the other side. Okay, so those are the 3 exercises from the study below. Hip exercises that were found to help people with low back pain. So give them a try and let me know if you have any questions down in the comment section. All right, you guys, see you next time. Bye.